Hi, everybody, and welcome to This Week in Global Health, a regular news and relevant topics in global health series. Today, we have a special episode on the topic of fistulas, a medical condition that's suffered by many women around the world with both social and health ramifications. And we're talking about fistulas today as the United Nations has declared May 23rd International Day to End Obstetric Fistula. So you can see this is not just something that we at Twig are caring about. This is something that actually the United Nations is highlighting about and saying it's that important. But before we go into the topic, let me introduce ourselves and where we're reporting from today. I am Jessica Taff, and I'm reporting to you from the Washington, D.C. metro area.
I'm Marie Anakamaya, and I'm reporting to you also from Washington, D.C.
Hi, I'm Sarah Borg, and I'm talking to today from London in the United Kingdom.
Great. Well, thanks, ladies. That's great to have you guys introduced to our everyone out there that's watching us, in case you are new to this series or not, and hopefully you keep watching. But why don't we get straight into the topic? Sarah, I know this is an area that you have worked in, so why don't you tell us a little bit about fistula? What is a fistula?
Okay, so specifically an obstetric fistula is a hole between the vagina and the rectum, or the vagina and the bladder. And this is caused by injury during childbirth. This leaves a woman incontinent of urine or feces or both. And in low-income countries, obstructed prolonged labor is the most common cause. Now, in terms of who it affects and how many people it affects, it's hard to know the exact incidence of obstetric fistula, as the population that's often access to medical care, and thus it's not recorded. But it is estimated that approximately over 200 women worldwide have obstetric fistula, and they're almost exclusively concentrated in sub-Saharan Africa and Asia.
Got it. That's a lot of women that have that. Is there any way that we can prevent it?
Yes, so actually fistula can largely be avoided by delaying the age of first pregnancy, timely access to obstetric care, and the cessation of harmful practices such as child marriage and female genital mutilation. Understandably, though, obstetric fistula affects the poorest women whose voices are rarely heard. Many live with these conditions for years because they can't afford treatment.
Yeah, okay, so Marie, you talked about some of the causes of or associations of fistula being with early child marriage or women having or girls having children early. And I wondered if you could, well, Marie, you don't have to explain it. Actually, I was going to want to ask Sarah a little bit about this because Sarah's worked a lot in reproductive health, and I was hoping she could explain this a little bit more. To the viewers, it may not be obvious how early child marriage or childbirth might lead to a fistula. So could you tell us a bit about that, Sarah?
Yeah, so I mean, with child marriage, this can involve, really young girls being forced to get married, and then after they get married, they have babies. Some of the girls can be 12, 13, 14. And there is actually a direct correlation between younger girls under the age of 16 having higher rates of obstetric fistulas. This is because their bodies aren't developed yet enough to really cope properly with childbirth. So actually 25% of obstetric fistulas occur in girls who are under 16. So that's kind of why child marriage does need to be tackled to this problem.
Got it. All right. So what if there's prevention? So that's one way to prevent it. But what if, I mean, it's going to happen. If we can't prevent everything, how do we treat it?
Sure. 80 to 95% of obstetric fistula can be repaired with a single, simple surgical procedure.
Okay. So it's just like one procedure. I have read actually that maybe sometimes they have to be multiple procedures. Do you know anything about that? I mean, 80 to 95% is a lot of surgery, or a lot of them, I guess, that can be repaired, but there must be others where it's harder to do that?
Yeah, so a kind of a simple, uncomplicated obstetric fistula can be fixed with this single surgical procedure, and like I said, that's 80 to 95% of the cases. And then sometimes if it is more complicated, they will require further treatment, like more than one surgery. The majority really can just be fixed with one easy procedure.
That's really good to know, because I mean, it sounds like a really horrible thing to have in that region of your body. It's your reproductive organs, and I don't even know what to kind of call them. Your waste organs. I don't know, the other areas, and we have something that's so vital to living.
Pelvic organs.
Thank you. That's a great way to do it. Pelvic. It kind of encompasses everything there. But yeah, but that's so vital to our livelihoods and just general comfortable living. I mean, not even comfortable, but to living. To have that all messed up, that's really upsetting. So it's good to know that with one surgery, a lot of this can be fixed, and it's, this treatment or this problem can be fixed. Now, we've talked a lot about the medical implications of this and kind of physically what it is and what happens. But I know that beyond the medical side of it, there's overall kind of health issues that go with it, and there's social issues that are associated with having a fistula and living with it. Marie, can you tell us a little bit about that?
Absolutely. So obstetric fistula typically leaves women incontinent, as you can imagine, with the hole that results in their bodies. And the acid in the fluids that drip from this hole can cause ulcers and infections. And a lot of times, to reduce the dripping, affected women often limit their fluid intake, which can lead to dangerous levels of dehydration. Some also experience kidney disease and failure as a result. And then only about 25% of these women who suffer a fistula after a first pregnancy are able to have a living baby, and often end up childless. And in addition, the nerve damage that can result from obstructed labor, which is directly linked to the development of a fistula, can also lead to paralysis in the lower limbs, so leading to a loss of mobility as well. The main social consequence is essentially sociocultural stigmatization, where these women are usually shunned by their communities, including husbands and close family members, because of the side effects of incontinence and the ulcers, so the smell and so forth, and just are generally marginalized by their communities, because in some places there are beliefs that this is not a medical condition and there's some other supernatural things and so forth that may be the reason that this is happening to the women. And because fistula often affects younger brides, they may have forgot their education in order to get married, and so when they are divorced, disowned, abandoned, they're often left in poverty and really without many options. And unfortunately, the resulting thing, especially from the health consequences, is, some of them don't even survive childbirth.
Wow, that's I mean, all of that sounds really, really tough, and it reminds me of something else that I read actually about fistula. And I know that today we're talking about obstetric fistula because that's what the UN is focusing this day on. But there is actually another notable cause of fistulas, and that's physical trauma from rape. Now, in our past episodes with Twig, we've covered how sexual violence is a global health issue, leading to health complications. But this is another example. And I really want to highlight what I read about in this Time magazine article, where they're talking about a particular situation in which sexual violence leads to fistulas, and that's during times of conflict or crises. So this article, and we will have this, we'll have this in our links along with the video. The article talked about rape during war, and it vividly discussed the common and often unspoken occurrence of sexual violence during war. Now, they talked about both women and children. I mean, young girls and, like I said, children even are brutally and repeatedly raped by soldiers. And you can imagine, for any woman, repeated rape over days by several men and with objects would no doubt result in physical trauma. But can you even imagine what the extra trauma would be like for a child? So, it's not surprising that these fistulas are a result of this. I mean, the entire thing is absolutely horrific and inexcusable. But the fact that you get fistulas from this, and it's because of this damage from these rapes, that to the fact that like what Sarah was saying, it could even be so brutal that it requires several surgeries to fix the damage. And then even if you fix the damage, you're at risk you're at risk again when another conflict arises. So, and then again, some of the damage is irreparable. Maybe these women they're incontinent, or they can't have children. It's really horrible.
I agree. I mean, the article was very difficult to read because of the vivid descriptions of rape and, obviously the jarring medical, mental, and social consequences. I will say I'm glad that it was candid about the issue, because sexual violence during conflict should be addressed, obviously for human rights reasons, but also because of the health complications associated with it, including fistulas. And so hopefully bringing attention to it will help start to bring light to the issue.
Right, right. Well, I don't know if you ladies have any other comments on these issues that we've talked about. Anything else you want to add? All right. Well, if that's it, I think, we've talked a bit about the obstetric fistulas, which the UN is highlighting, and also this other unfortunate occurrence of fistulas that are caused by rape that are happening especially a lot in conflict regions. But that's all we've got for tonight, and I hope you guys as an audience have learned about fistula and what a problem this is around the world for a number of reasons, be it just early child marriage, natural childbirth, or very brutal childbirth that can happen, or rape. But if you guys did, and you feel like you want to keep the discussion going, let us know what you think about the issue. Comment on a video on our YouTube page, or you can tweet at us at Twig Team. And if you liked the episode and you want to watch more, please subscribe to our YouTube channel, or you can find us and more episodes that we've been doing for a while now on our webpage at www.twigh.org. And there's other places you can find us. We are on LinkedIn, we're on Twitter, we're on Facebook, we're on Instagram, and we have a blog. And all this information you will be included with the video. And if you're not the type of person that likes to watch things on YouTube, you like listening to podcasts, we actually have a purely audio version of this podcast. So yeah, you can check us out, and we hope that you enjoyed this episode, and tune in again, and we will see you later. Thanks.